Hello class, my case study today is based on osteomyelitis. Osteomyelitis is the inflammation of the bone and the bone marrow. It is secondary to infection, viruses, parasites, fungi, bacteria. There's two types of osteomyelitis. Hematogenous circulating pathogenic organisms reside and the metaphysis of long bones due to poor circulation to the bones. And there's also non-hematogenous, when parasites are ejected into the bone such as trauma or open fractures. Acute hematogenous osteomyelitis is the most common type of musculoskeletal infection in children, with an estimated incidence of 1 case per 5,000 children per year in the United States. It is primarily a disease of young children, with approximate half of all cases occurring in children 5 years of age or younger. Okay, the case study says a 2-year-old fell from a car on March 19, and on March 27, she's having difficulty walking. On April 4th, she was diagnosed with fracture of the distal femur, and they apply a long leg cast, and the cast was removed on May 24th. 2 months later, July 26th, she became healed, but she didn't have any difficulty walking. X-rays show lateral and posterior soft tissue swelling around the distal femur. An MRI confirmed a fluid fill in the distal femur that communicates with the soft tissue to a posterior perforation of the distal femur. The 2-year-old had chronic osteomyelitis. The symptom persists after 1 month of appropriate antibiotic treatment, and even with inadequate treatment, it's still considered chronic osteomyelitis. It may be severe and difficult to treat, with minor signs, symptoms, and serologic abnormalities. It resulted from trauma, joint replacement, orthopedic hardware like fixation, and Mycobacterium tuberculosis or syphilis infection. There's also chronic recurrent multifocal osteomyelitis, is a non-bacterial, non-infectious inflammation of the bone that has been characterized as an auto-inflammatory disease. The frequent site of involvement include the metaphysis of the long bones, clavicles, spine, and pelvis, the mandible, scapula, ribs, sternum, hands, and feet. So my first article called Update on the Management of Pediatric Acute Osteomyelitis and Septic Arthritis, and I highlight the complication, and it says osteomyelitis cannot be overlooked because it can cause sepsis, joint destruction, growth failure, even death if the patient is not correctly treated. Osteomyelitis has virulent bacteria strain and can be resistant to antibiotic. So it will make treatment more difficult, and it's pushed for the needs to have a new antibiotic available. Now note, no article has proven the best antibiotic therapy to be administered to treat osteomyelitis, the mode of administration, and the duration of the therapy. To talk about the diagnosis, I chose the article Whole Body Diffusion Weight Imaging and Chronic Recurrent Multifocal Osteomyelitis in Children. And it says MRI helps an early diagnosis of osteomyelitis. It shows bone marrow involvement, detects fluid collection and abscesses that may occur in the bone marrow edema, soft tissues involvement, and also assists with drainage and surgical treatment. MRI is also sensitive to detection of periosteal elevation and the presence of fluid collection. Imaging of the contralateral body part is often helpful for this and is more easily obtained during imaging of the pelvis and lower extremities. Okay, last article talk about the treatment, and it's called World of the MRI and the Diagnosis and Treatment of Osteomyelitis in Pediatric Patients. And it says antibiotic therapy is the treatment of choice for osteomyelitis. The antibiotic is initially chosen on an empirical basis to cover the most frequent pathogen responsible for this condition based on the age of the child. It is administered based on the lab result obtained before starting antibiotic therapy, which is the blood culture, or it can be intra-articular liquid or bone fragment. It is crucial to treat all infants and children who are admitted with osteomyelitis due to their severity, clinical condition, and complication. Thank you.